not get my slides to move. Sorry. We checked. There we go. Did that work? Did it
Yes.
move? Okay. Yay. Right. So want to thank the Office of Equity, Diversity, and Inclusion for holding these virtual dialogue series, the Lunch and Learns. I really appreciate the opportunity to be here and present on different topics. I'd also like to go ahead and highlight our new office, the Office of Social Justice Identity Initiatives and Identity Programs. We've just recently expanded from the Office of Student Life, and so we are one of the newest offices on campus. So just want to put a little shout out there for our new office. Thank you, everyone. And just to help folks be aware of who we are and what we're doing. So our vision is basically to help every UC Merced scholar to thrive in our multicultural global society. Our mission is to enhance the retention of our historically underserved scholars and to foster an inclusive campus environment for all by providing opportunities for holistic development, intersectional community building, and student agency. And then we are also committed to our diverse scholar community, and we seek to influence university policy and practices to position our campus as a hub for transformative leadership and social change. So that's just really quick our new office's vision, mission, and commitments. So just be on the lookout for us because we are doing lots of new things and continuing some amazing old things. You can contact us by email and go to socialjustice@ucmerced.edu. We also have Instagram and Facebook if you're interested in connecting with us on those different media sites. Once we get back to campus, we will be in KL 167 again. And then we also have all of the cultural and resource centers on campus that we oversee, as well as oversee the social justice living learning community in Afro Hall and women's and gender equity programs, as well as a number of different workshops and trainings regarding social justice and identity development. So that's how you can contact us, and those are some of the things that we cover. So we are going to be talking about how the LGBTQ plus community has been impacted by COVID-19. So I'm going to be giving you lots and lots of information, statistics, facts, and stuff like that. So please bear with me, and then we'll have a little bit of discussion. We will also talk about things that you all can do, and then I've got a number of resources that I'm not going to highlight all of them, but I will pull up just a couple to highlight for folks. Okay, any questions thus far? Okay, so before we fully get started, I would just like to take a moment to recognize the 11 transgender individuals that have been murdered since January 1st, just in 2020. So if we could take just a few moments of silence to recognize these individuals, I would really appreciate that. Thank you so much. So I appreciate you taking that time just to recognize the fact that our community continues to be targeted with violence, and considering it's only May and we've already had 11 folks murdered, that is pretty disturbing. People of color continue to be targeted by violence across the nation, and you're seeing it everywhere. And in particular, our trans women of color seem to be impacted far more than other communities. So just please keep those folks in mind. So I did introduce myself as Angie Baxter. However, my pronouns are she, her, and hers. So I kind of got ahead of myself, but that's okay. I normally do that. Bear with me, please. Thank you for coming. I appreciate that. We are going to be having a conversation today. So one of the things I'd like to do is make sure that we have some commitments that we talk about really quick to make sure that we are creating an environment where folks can share freely. So one of those things I'd like to go over is going out on a limb. So basically that means please ask any questions that you have, but ask them with respect and curiosity for all folks within the room, okay? Take space and make space basically means that we all have different comfort levels with sharing. Some folks share more, some folks share less. Please make sure that we're giving space for everyone to be able to participate if they choose to do so. And we challenge folks that don't normally participate to go ahead and actually engage with the conversation. One person, one mic basically means please allow folks to finish their discussion points and actively listen to what they have to say before forming what you would like to say and interrupting them. Okay, then practice grace and humility. So we all come here with different levels of knowledge, understanding, language. So please be patient not only with yourself, but other participants and their learning because of that background. We don't necessarily know where everybody's at. And then what's said here stays here, what's learned here leaves here. Some folks may choose to share stories that are very personal to them. And so we ask that you not share what those stories are, not share who is in this session with us and talking about those stories. However, you do get nuggets of learning that come out of those different stories. And then the other information that we'll provide during this conversation. Please be willing to share what you're learning. Just allow that safety for folks to be able to share. Any questions about those commitments and or anything else you would like to add to those commitments? Go ahead and put it in the chat, and I don't have access to the chat, so Lorene and Onar will be helping me with the chat. Anybody putting anything in chat?
Nope.
No, we're good? All right. Lorene and Onar, would you like to introduce yourselves as the other two trifectas of our office?
Go ahead, Lorene.
Okay, I was waiting for you. Yeah, thank you, Angie. Hi, y'all. My name is Lorene Fisher. I use she, her, hers pronouns, and I am a coordinator within our office, and just excited to be here to support Angie in this presentation and all of our community who are able to join in today.
Yes, thank you all for coming. My name is Onar Primitivo. I serve as the director of the Social Justice Initiatives and Identity Programs. My pronouns are he, him, his, and just really I'm thankful for a critical time for us to be discussing this topic. And thank you to Angie and the EDI office for creating this space. Thank you.
All right, thank you so much for sharing. I appreciate that. So we are actually going to be going ahead and getting into the different topics. Before we get started, I do want to say that I am by no means an expert on all of these various topics that we're going to be talking about. While I've done research to help familiarize myself for this presentation, other people in the community may actually have more information than what I have, may have more up-to-date information than what I have. While I've done this research, I don't want to be seen as the expert in all of this information because we all bring that information and that expertise to this conversation. So just putting that out there. The first thing that we are going to really talk about is going to be how we are actually being impacted by COVID-19. So like I said earlier, I'm going to be providing a lot of statistics right now. With that in mind, these are just some of the resources that I have utilized to find this information out. I do have source pages at the end of the presentation if you're interested in them, but these are just some of the places that I've gone, okay? We are going to be talking about health, safety, economy, and then immigration, because there are so many different topics that we could have talked about with this. I wanted to try and limit it and have it be a little bit more confined, so that this conversation didn't go on for, a couple weeks, because we could certainly do that. Any questions about what we're going to be generally covering over this next 40 minutes, 45 minutes? Okay. All right. Okay, so we're going to go ahead and get started with some health information. So one of the things that's really important to understand is the Human Rights Campaign actually have estimated that there are 14 million LGBTQ plus adults and over 2 million LGBT youth living within the United States currently, okay? And more than 5 million work in jobs that are more than likely to be impacted by COVID-19. So we're talking about like restaurants, food services, hospitals, K through 12, higher education, and then retail industries. So that's just kind of a roundabout of the community to let you know what we're really looking at, okay? And when you think about having 14 million adults and 2 million children, and you're thinking about healthcare, it's really important to look at the ways in which our community is more vulnerable, which communities within the LGBTQ plus community can be more vulnerable. Understanding the intersections of whether you are HIV positive, if you are utilizing drugs and alcohol, whether you even have access to healthcare, and then mental health, and then with the social isolating or social distancing, what is that doing to the isolation issues within our community? And then healthcare coverage in general, whether or not we have that. So we've found that 17% of LGBTQ folks actually completely lack healthcare coverage. 1 in 5 do not see doctors because they cannot afford it. 37% of LGBT folks smoke every day compared to 27% of non-LGBT folks. And then also 21% of LGBT folks experience asthma compared to 14% of non-LGBT folks. So with just that information, it demonstrates that our community is more impacted by these different health issues. And with COVID-19, it is a virus that attacks folks that are have vulnerabilities with their respiration. And so if you smoke or you have asthma, if you have COPD, you are far more likely to get COVID-19 if you are exposed. And so if we have a higher population compared to other populations, that means that we are uniquely getting impacted by COVID-19 at a higher rate than what other folks in the community are doing. So in addition to that, just recently, the Department of Health and Human Services is actually implementing civil rights provisions in Section 1557 of the Affordable Care Act, excluding protections for the LGBTQ plus community. So what that means is that folks that traditionally had protections with the Affordable Care Act and had the ability to access resources within the Affordable Care Act are no longer protected because of their sexual orientation and or gender identity. That could disproportionately impact our LGBT community from utilizing health services, experiencing more discrimination, being turned away from hospitals and from doctors if they are sick, either with COVID-19 or with any other ailment. And so that's really an increase in the access that our LGBTQ plus community has. Further, it's increasing the mental health issues within our community. So one of the things that's really important to understand is that 46% of trans folks compared to 31% of cis LGBT folks have thought about taking their lives. And when you think about that statistic, and think then about how COVID-19 is also impacting their access, impacting their ability to connect with other people, you see that this area, the mental health of our community, is very important to focus on and provide support and resources. So we will talk a little bit about how you can help folks that might fall into this category, that are having challenges with mental health in a little bit, but just wanted to raise your awareness regarding the fact that there are a lot of folks that are being impacted with their mental health. We've also found that social isolation impacts the LGBTQ plus community more before the COVID-19 happened. A lot of times we may not be out. Our families may not be accepting of who we are. We may feel unconfident and not feel safe in the environments that we're in. And so we have a form of social isolation prior to the COVID-19 pandemic happening. And so adding the COVID-19 pandemic on top of the isolation that many of us have experienced before disproportionately impacts our ability to be connecting with others. And again, that means that we need to be being more strategic and intentional about our outreach to folks within our LGBTQ plus community. In addition, there's issues with healthcare coverage. Sorry, checking the time. So 17% of our LGBTQ plus adults do not have any form of health coverage at all, compared to 12% of non-LGBTQ plus folks. Also, 23% of our LGBT folks are adults of color, 22% of the transgender adults, and 32% of transgender adults of color do not have any form of health coverage. So what that means is if our community is sick with COVID-19, they don't have the insurance to help them pay for any support or any medications or doctor visits if they even access the healthcare community and get services for that. So it's really important to understand those intersections of identities and how those are impacted, not just with health coverage, but then how COVID-19 disproportionately impacts our community from accessing those resources. Are there any questions about any of the health on this at this point?
None that I see.
Okay, all right. I'm sorry, I forgot, assessing healthcare or accessing healthcare. So I think I mentioned really quickly that our community is disproportionately discriminated against within health systems. Primarily our trans folks of color. They have a lot less access and protections within the healthcare, and so they don't actually access those services and resources as much as other folks within the LGBTQ plus community, and it is also at a lower rate than the rest of our general population. So understanding that stigma and discrimination are still huge topics within health. Well, it's huge, not just in health, but just within our population, but in particular within health. Next, I would like to go ahead and talk a little bit about safety. And I know that I'm going through stuff pretty quickly, but just recognize that this is just a real quick overview of some different aspects that COVID-19 is disproportionately impacting with our community. So when we're talking about safety, we're looking at domestic violence and abuse. We're looking at homelessness. access to resources, and then also stigma and discrimination. So it's really important to understand that 43.8% of lesbian women, 61.1 percent of bisexual women, compared to oh, sorry. I lost that. I didn't finish that. Sorry. Okay, so 43% of lesbian women and 61% of bisexual women actually experience domestic violence and abuse at higher rates than the typical population. So when you're thinking about our community, domestic violence and abuse happens at a higher rate. Because of our identities, we are socially isolated. We don't have as many resources as other folks, such as shelters that specifically cater to the LGBTQ plus community. And for women in particular. Women on women violence is usually not seen as serious as man on woman violence within the home. So those are issues. In addition, 26% of gay men and 37% of bisexual men also experience domestic violence and abuse. Further, in 2015, we did a US transgender survey, and we found that 46% of trans folks have been verbally harassed. Nearly 47% have been sexually assaulted. 72% have done some form of sex work, and then 54% experience intimate partner abuse. And so when you're looking at COVID-19 and all the many stay-at-home orders, if folks are experiencing domestic violence and abuse in their home, if they are having to stay home because of the COVID-19, they may be experiencing increased abuse from their partners, if that's what's going on in their home, because they're less likely to be leaving their partners and going to work, less likely to be going to school. And so that access to having your partner there in that domestic violence situation increases the opportunities of violent episodes. Okay. Also, when looking at safety, there's issues with homelessness. So 7% of our youth within the United States identify as LGBTQ+. Of that 7%, 40% of them are homeless. Okay. So LGBT youth are also 120% more likely to experience homelessness versus cis and straight counterparts in the community. 30% of our youth in foster cares are LGBTQ plus identified, and approximately 40% of them are, like I said, homeless. And so when you're thinking about homelessness and our community, it's very challenging because we experience higher levels of homelessness because of our identities, because our families have kicked us out, because we do not have access to the same resources in order for financial support. Our communities experiencing not getting jobs, especially our trans women. They are disproportionately rejected and denied access to jobs, access to services and resources at jobs such as healthcare and medical leave. And so when you're looking at that homelessness issue and the fact that we're supposed to be social distancing because of COVID-19, that's very challenging within our community. First of all, how do you social distance if you don't even have a home? How are you supposed to stay at home when you don't have that home? So it's really important to understand that because of COVID-19, our youth and our LGBTQ plus homeless folks population are having more limited access to resources, do not necessarily have space to stay at home with, and then also experience lack of access to resources because folks are being ordered to stay home and businesses are shut down. So many times our soup kitchens, our social services, they're not functioning at the rate that they did prior to COVID-19. And because we have higher rates of folks within our community accessing those resources are not open, functioning, and available to them, we have higher risk of safety concerns for our homeless folks. In addition, continues to be stigma and discrimination that is experienced by our community in various different aspects in our lives, including not only the work, but also not necessarily getting the same service from folks such as at Walmart. Our trans women of color get followed at disproportionate rates. And so when you're looking at the combination of all of these different things, safety becomes a far more challenging issue for our LGBTQ plus community because of COVID-19. Any questions about safety? This section. Okay, sounds like there's not any questions. All right, so I'm going to go ahead and move on to the economy. So as I said earlier, the 5 industries, restaurants and food service, like hospitals and education and universities and retails, are the most impacted industries by COVID-19. And those 5 industries actually have a high participation of our LGBTQ plus community. So 40% of the LGBTQ plus community compared to 22% of non-LGBTQ individuals work in these industries. In the food and restaurant industry, 15% identify as LGBT. 7.5% identify within hospitals, 7% K through 12 education, 7% in colleges and universities, and 4% in retails, and in the retail business. So what that basically means is folks within these communities have disproportionately been impacted by the COVID-19 due to stay-at-home orders, businesses closing up, the lack of support for these different areas. If you do not have a job, you are not going to be able to pay for your rent. You're not going to be able to pay for food. And with our community, that is disproportionately impacted. So 1 in 5 LGBT people actually live in poverty. As I've said earlier, 40% of our youth are homeless. In 2019, the Williams Institute analyzed the behavior risk factors surveillance system, and they found not only that 22% of LGBTQ plus adults live in poverty, but only 16% of our straight and cisgender counterparts live in poverty. And so our poverty level within the LGBTQ plus community is far higher than the general population. Also, poverty rates for the transgender community is at 29%. And cisgender bisexual women, it is 29% over the general population. In addition to that, our Black and Latinx transgender adults, it's 40% that are likely for Black transgender folks to live in poverty, and then 45% of our Latinx community live in poverty. And so 1 in 10 of our LGBT folks are unemployed currently unemployed. And so when you're thinking about COVID-19 and the fact that we are disproportionately in the industries that have been most highly affected by COVID-19, we're going to see that our income levels are going to decrease significantly, which everybody is definitely feeling that. But if you are closer to that poverty line or already living under poverty, in poverty, then you're going to have a deeper impact than others that are not. And so our community is disproportionately impacted in those industries. Okay. And then we've also found that in a study, 30% of LGBT folks are worried that their hours are going to be reduced compared to 20% of the general population. And then also 14% of the general population is worried about being unemployed, whereas 12% of the LGBTQ plus community is worried about being unemployed. So when you're looking at employment and hours, that's going to significantly impact the ways in which our community is going to be able to be a healthy part of our economy here in the US. Now, granted, this is only looking at the US. This is not looking at the entire world. And I think that those percentages would be far larger if we were looking at the world and the impact of COVID-19 across the world. So, any questions about economy at the moment? Okay.
None.
So I just want to talk very quickly about some immigration issues. So one of the things that's really important to understand is that with social distancing, it's important to allow space for you to be able to not be in direct contact with becoming infected with COVID-19. So when you're thinking about detention centers, they are overcrowded as is. And what they have found in the detention centers that LGBTQ plus communities and folks that identify within those detention centers actually are treated worse than what our cis and straight counterparts are treated within those detention facilities. They experience more unhygienic conditions, and they have a lack of health information that is specifically targeted for our LGBTQ plus community, and there's a lack of resources. So in addition, I'm not sure if you all have heard, but our government has actually suspended green cards for LGBT folks. So anybody that was seeking asylum or within the US, they are directly impacted if they identify as LGBT because our government is not providing the same resources and support as other folks. Okay, I do have a little video that I'd like to have you watch that talks directly about our undocumented community. So if you give me a second, I'm going to pull that up.
Of Bay Area workers who won't get much help, if any at all, because they are, they're here illegally. Their immigration status is in question. KPIX5's Donald Lynn reports from Oakland.
For those day laborers behind me, they tell me staying home is simply not an option. Many of them are undocumented immigrants. That means no unemployment benefits and no stimulus checks.
I got to pay my rent. I got to pay my gas for my car.
This day laborer who goes by Correa says he's more scared of no job than the coronavirus.
3 kids and my wife, so she stopped to work. because she's working hotels and the cleaning.
His family is running out of money, and he worries they'll die of starvation before they get the virus. He and his wife cannot apply for benefits because they don't have legal status. Undocumented immigrants who worked in hotels, restaurants, and other service industries face the same problem. Many of them paid taxes, but they just don't qualify for any help.
Normally it's hard, but now it's totally hard.
Correa has waited for jobs at street corners, but with many construction projects now considered non-essential, there's very little work. A group of day laborers at the Oakland Home Depot this afternoon surrounded a homeowner looking for one day laborer.
We don't have any money for rent. We don't know what to do.
Activists are telling immigrant communities about the rent moratorium, but many remain fearful of eviction.
Telling them to practice social distancing. We're talking about washing their hands. They're like, well, where do we wash our hands? We don't have a place while we're on the street corner.
As for Correa, he received food and $100 from the nonprofit Street Level Health Project, which helps gay laborers. And the nonprofit got a little boost itself, a personal check from Councilman Noel Gaya.
Oh,
We're giving you $500.
Oh, wow,
and
thank
next
you.
Monday you get another $500 to support our day labor program.
Thank you so much.
Nonprofits like Street Level Health are asking for donations so they can give out money to those who don't qualify for government benefits. In Oakland, I'm Darlin, KPIX5.
All right. There we go. Okay. So that was just a real quick video talking about how our undocumented community is impacted, and it does not have access to the same resources that folks that are documented within the U.S. have, even though they pay into taxes, even though they support our economy. What's really interesting is that our community, the undocumented community, many times if they are working in industries where it's mandatory to continue to work, and so they are being exposed to COVID-19 at higher rates because of working in those communities, such as on farms or in grocery stores and in fast food places. So it's important to understand that our community, our LGBTQ plus undocumented and immigrants are disproportionately being impacted by COVID-19. Is there anything from that video that anybody would like to just briefly point out or talk about? Now's an opportunity.
You can use the raise your hand feature.
So what was one thing in the video that you had not thought about prior to watching the video? And anybody can answer. I'm putting folks on the spot. And I can't see if anybody raises their hand or not, so.
That's fine. Angie, I don't really necessarily have a question, as more of it is like a statement of everything that's going on. But all these things that you've talked about and mentioned have impacted this community prior to COVID-19.
Yes.
So, and this just enhances it more with it. So I'm trying to figure out what the resources are out there to even take small steps to help, I guess, to see what we could do, you know, and to keep this conversation going, you know, prior to pandemics happening, or even if something else happens in the future, of just, you know, seeing everything, the inequality that happens across the board with everything going on. I mean, this just kind of enhances it a lot more, but it's things that have been going on for years and years and years that no one's paying attention to. So how do we keep it in the spotlight beyond this?
Okay, so that's really good, because that actually is directly going into what I was going into next, which is ways that we can support the LGBTQ plus community. And right after that, I'm going to have some resources available. So I'll show you those. Right now, I wanted folks to just take a few minutes, and if you have a pen and a paper, write down a couple ideas that you have that you might be able to do within your small realm right now, your circle of influence, that you might be able to do. And then I'm going to have you go into, oh, I can't do breakout rooms. Desiree, could you set up breakout rooms?
Let me see what I can do. Hold on.
Sorry, I should have done that prior to us beginning this, because I'd like folks to come together and talk about what are some things that they could do to support the community.
Well, I wonder if it's a small enough group, Angie. It's 12 of us. Did you, I don't know if, happy to do the breakout rooms, but I don't know if it's also we can do, just wanted to let you know that. I know you can't see the participant box.
Yeah, I can't. So, well, if it's only 12 of us, let's go ahead and just have that conversation. What are some things that you think y'all could do?
Yeah, so we have a question on the chat box from Jim. Stating, did you see some differences or concerns as it relates to larger cities or smaller communities like Merced?
So I didn't look specifically into differences between larger cities and smaller cities. I do know that one of the issues that we've talked about in our area is the fact that we are approximately a month behind what the experiences of COVID-19 have been in like San Francisco and LA and San Diego area. So we are going to be impacted for a longer period of time than those areas. But I did not look specifically into different concerns as it relates to larger cities and smaller cities.
Thank you.
Okay. So, however, with that said, when we get to the resources, I did divide the resources up into local resources, statewide resources, national and international resources. And I didn't, there's a whole list of resources that I have because there's a number of places that provided multiple different resources. So I took and used those hubs as the resource. Because I'm not sure where everybody is at, so I wanted to make sure to try and give multiple different options. So,
and also on the chat box, Babni, thank you that there's resource available for undocumented families and AB 540 students who are not eligible for stimulus funds, and it must be individuals, families, or households in the San Joaquin Valley, and there's a link to that.
Mm-hmm. Any other things that folks feel like they could do?
I can respond a little bit, Angie. I mean, it's challenging because so many of the statistics you provided often feel out of our control, right? Like, or it's kind of that message in my mind of like, the situation is so much bigger than you. So what can you do even minimally? Immediately on my mind is just thinking about the folks who I already know who identify within the community, just taking time to check in with them to see how they're doing and make it known that even if the conversation isn't a desire right now, that like I will be there in case folks do need a space to talk or share, or if they are in need of resources. I may not have the capacity to provide resources myself, but I can definitely look and connect them with those that I am aware of.
So I just shared with you all a really short list of what I came up with, and others have suggested online. So like Lorraine said, reaching out to the folks that you know, because some of our community may be a little bit more isolated because they don't necessarily have families that they can go back to, or they are not out to their families. Reaching out to them via email, by calling them or Zoom, to help build that connection and help them feel not as isolated, can do worlds of difference for our community. So if you know anybody who does identify as LGBT, just do a simple, even text them, message them on Facebook and just say, hey, I was thinking about you. How are you doing? So just simple outreach will help with social isolation, And then for things that you feel like you have a little less control over, such as like employment and stuff like that, there are opportunities to volunteer and support. So you can volunteer for a number of different hotlines online. So such as the Trevor Project. So the Trevor Project is a resource online for folks that have suicidation to call into and find support immediately by talking with somebody. So you could volunteer and they'll train you to be able to talk to folks that are in that crisis state. So you could volunteer on hotlines like that. You could also, if you felt compelled, you could volunteer at whatever soup kitchens are available, because there's not as many people volunteering to provide food and support the homeless folks because of the social distancing. Obviously, wear masks and gloves if you need to, if you choose to do something like that, but there's an opportunity to volunteer there. You can set up opportunities to go shopping or run errands for folks that are self-isolating or who may be directly impacted with COVID-19. You can take folks to their health appointments or whatever essential appointments that there are. You can organize food deliveries. You could also volunteer to host well-being classes online, or you could just do social activities online with allowing folks to come in and join in, do online bingo or something like that. But that's going to help with like that social isolation, that connection to folks. Some of those things will help provide resources and services. I put on there, donate food to food pantries. I know that, we're all in this place of not knowing what our income is going to necessarily be like, but we can always give canned goods or box goods to food pantries. Or if you do have extra money, which most of us probably don't, but if you do have extra money, you could donate money and resources to like charities and scholarships. So for example, the Queens of the Castro right now is giving $200 scholarships for folks in need for emergency situations. Well, if we're not replenishing that money and giving money to them, they're not going to be able to continue to provide those scholarships for those emergency situations. So if you have that, you can always donate. And then one of the things that I think is really important that people overlook often when you're looking at institutional discrimination and issues within institution and structures is you can always contact those folks that make our decision makers. You can contact our politicians. You can contact your upper leadership within organizations, within businesses, and you can talk to them about, well, how do we make sure that we are ensuring that our LGBTQ plus community is not disproportionately impacted by the COVID-19? How do we make sure we have non-discrimination policies that are protecting? How do we make sure all of our family leave is accessible for all of our LGBT folks. So you have the ability to contact these different places. And then there's just the simple going out and supporting LGBTQ plus owned businesses. Buy locally from them. Order food, order supplies, get gift cards and vouchers. And then if all else fails, you can sit down and do research on these different topics and learn about them. Take webinars, watch YouTube. So those are different opportunities that you can do to get involved with the community and how you can make some changes, positive changes in folks' life. Now, I didn't cover, obviously, everything that I've mentioned, but these are just general ideas.
So Angie, regarding that last point on your slide, we have a question in the chat box. Is there a list of local LGBTQ plus owned businesses?
Here in Merced, no, but I have folks that I know that own businesses. I could contact them and find out if I could make that list and then send that out. But there's a lot of folks in our community that are not out because they're afraid of the impacts of what would happen with their business. So I know that there's LGBT friendly businesses out there, such as Coffee Bandits, that do a lot of supporting of our community that you could get coffee from versus Starbucks, you know? So there's opportunities like that. Let's see, we do have an LGBTQ Alliance organization here in Merced, and you can find them on Facebook, and you can contact them and see if they have any online support groups that they're doing. If I remember correctly, most of their groups have gone online, and they do have ally groups as well. So contacting them would be a good opportunity to reach out and connect with folks as well. Any other questions? All right, so I only have a few minutes left, so I'm going to go ahead and move on to some resources. And I am going to only highlight one of these resources. What I'm planning on doing is taking these resources in the Central Valley, or all of my resources that I've got, and putting them on a form, and I'll see if we can send them out to all the participants that came. And then you could distribute them. So I would like to go to, oh, and you can't see it. Sorry, let me fix that, sorry. Okay, so this is ABC 30, and these are a bunch of different resources in our community that folks can access, such as CalFresh. There's some Catholic charities, Central California Food Bank, City of Selma. So what I did is I kind of put resources that have hubs for other information. Okay, so this is one of them. So if you needed to go Salvation Army, you could click on that resource. There's also a number of different housing support resources as well on those various different pages. So if you take a look at that, you're welcome to check out all of those different resources that you can help provide for other folks, or that you can do research on. Oh gosh, lost the page. So United Way. So those are just some resources in the Central Valley. I wish it was easier to get through these. Okay, hold on a second. So I'm trying to go to California resources. And okay, it's not showing me what y'all are seeing. Are you seeing Northern California public media?
We're only seeing you right now.
Oh, okay.
Yeah. You stop sharing.
Sorry, I was trying to share it. Okay. So Northern California. So these are resources all throughout the Bay and Northern California. So there's like Medi-Cal for undocumented communities. Immigrants Rising, tangible support for immigrant communities during COVID-19. So there's stuff that is specific for COVID-19 on this list. And then there's stuff that is general throughout California. So that's some California resources. And I'm going to stop sharing the different resources because we only have a moment. So any questions about what I've covered today? I know it's been a lot, a lot of facts and statistics. Does anybody else know of other resources that we could utilize?
No, Angie, but I just wanted to say thank you. I think one of the things that we've really seen, like you said, the disparate impacts of COVID-19, not only on our LGBTQ plus community, but our Black and Brown communities too, and the intersection of that. So this was the first topic area we had on that. So I really, really thank you for giving voice to that.
Yes. Well, thank you for giving me the opportunity. I had far more information than what I would have been able to present. So unfortunately, I wasn't able to share it all. However, through all those different resources that I will be, hopefully, would you be able to, Danya, send those out to the folks?
Yeah, Desiree can facilitate to all registrants. So we can send everything you went out.
Fantastic. So I do have that list. And so that will give folks specific resources that they could utilize. And some of those different resources actually specifically talk about things that you can specifically do as somebody who wants to support the LGBTQ plus community. Okay.
Fantastic. Thank you.
All right.
Thanks, everyone.
Thank you. Sorry.
Thank you, Angie, Lorraine, and Owner. Thank you so much.
Thank you.
Thanks, Angie. Bye, y'all.
Bye.
Angie, if you want to send me the information, I could email it to everyone who's participated in.
All right.
Okay.
I will do that.